Hello, and welcome to the Cardiology Podcast, Why We Do What We Do in Cardiology. In this audio series, we will discuss the practice-changing articles in cardiology from the past to the present. This is your episode for today.
In this episode, I will discuss the FIRE trial, complete or culprit-only PCI in older patients with myocardial infarction. This was published in the New England Journal of Medicine on August 26, 2023. Older patients with acute myocardial infarction, AMI, have unique treatment challenges. The benefit of complete revascularization in older patients, greater than or equal to 75 years of age, with myocardial infarction and multivessel disease was unclear. They often have more coexisting illnesses and are more likely to have frailty issues. They also present more often with high-risk features such as heart failure and shock, multivessel, and complex coronary artery disease. Despite these challenges, early reperfusion of the culprit vessel with primary percutaneous coronary intervention, PCI, in patients with ST segment elevation myocardial infarction, STEMI, and an early invasive strategy in patients with non-STEMI, STEMI, improves cardiovascular outcomes, regardless of age. Approximately half of older patients with AMI also have multivessel coronary artery disease. Several randomized trials have shown that additional PCI of these non-culprit lesions with the goal of complete revascularization is superior to PCI of only the culprit lesion. The FIRE trial is the first randomized trial to evaluate the efficacy and safety of complete revascularization in older patients with AMI. The trial included 1,445 patients aged 75 years or older with AMI. Patients were randomly assigned to undergo complete revascularization or culprit lesion-only PCI. The results of the FIRE trial showed that complete revascularization was associated with a lower risk of the primary composite outcome of death, myocardial infarction, stroke, or any revascularization at 1-year follow-up. Complete revascularization was also associated with a lower risk of cardiovascular death or new myocardial infarction. The FIRE trial confirms the benefit of complete revascularization in older patients with AMI. The trial also suggests that complete revascularization is beneficial regardless of whether the patient presents with STEMI or non-STEMI. The optimal revascularization strategy in older patients with AMI is still being debated. The COMPLETE-2 trial is currently underway to compare physiology-guided revascularization with angiography-guided revascularization in this patient population. Finally, it is important to consider the individual patient's goals of therapy when making treatment decisions. Some patients may place a higher value on quality of life and the ability to live independently than on extending life or preventing future ischemic events. Thank you for listening to this podcast, Why We Do What We Do in Cardiology. The information in this podcast is for general information only for medical professionals and is not intended to be a substitute for medical advice from a qualified healthcare professional. We hope you found this information helpful, and we look forward to seeing you on the next episode.